The holidays are a time for celebration, but it can be easy to go overboard and especially tough for those who struggle with addiction. And joining me now is Dr. Anna Lembke, Medical Director of Stanford Addiction Medicine Clinic. Thanks so much for coming on the show.
Sure, I'm happy to be here.
Okay, so let's first of all talk about addiction. For those recovering from it, like alcohol, what are some of the triggers that cause a relapse?
Well, one of the triggers is just being around other people who are drinking. That tends to be a common stressor. Another is just trying to find a way to celebrate without using substances. Oftentimes we use alcohol to celebrate, and so not having that, people have to kind of come up with more creative ways to celebrate the holidays. The other things are just the usual stressors of the holidays that sort of we all struggle with. You know, being with family is a stressor.
It can be stressful.
It can be stressful. You know, not getting enough sleep, all of the typical kinds of emotional things, all the expectations we have about the holidays and how great they're going to be and how they turn out not often to live up to our expectations. So those are things that can trigger people, including people with addiction, who might have, you know, an urge or a craving to use alcohol to kind of cope with those types of stressors.
Okay, so say you're at a holiday party, someone comes up to you, offers you a drink, what do you say?
Well, you know, a lot of patients will ask me, they're really worried about that scenario and they feel like that's going to be really awkward for them. But what I say to them is, you know, if you just say no thank you, people don't care. You know, we think that people are going to really care if we don't imbibe with them, but generally people don't care. On the other hand, I have seen instances where the person who is offering the drink is really pushy with it. That's often because they may themselves have a drinking problem. They want to normalize their drinking by making sure everybody around them is drinking.
It's not a big deal.
Right, not a big deal, have a drink. So when there's pressure to drink, I will recommend to patients to say something like, I'm on a medication, I can't drink right now, or my doctor has suggested I not drink, I have a medical condition that I can't drink. Or, you know, some people are very open about their recovery. There's actually a movement called open recovery, where people are just like, hey, you know, I'm in recovery from alcohol addiction, so I don't drink. So that's another strategy.
And that should be, when you hear that, someone should say, okay, I'm done.
Yeah, right. There should definitely, that should be a hard stop.
It should be a hard stop for sure. Okay, so what happens if you accidentally drink something that has alcohol in it, you didn't know it did, or maybe you ate something that was spiked? Does that count as a relapse?
Well, that's a really good question, and it kind of depends on how you yourself define your recovery. I have had patients who are participating in Alcoholics Anonymous, a 12-step group for people with addiction, which can be extremely helpful for those who actively participate and for whom the philosophy kind of makes sense. And in that context, I have seen people have to say that they've relapsed even when they didn't know they didn't mean to. Because sometimes the not knowing is sort of not knowing and kind of really knowing. So I think at the end of the day, it's sort of how you yourself would define a recovery and define your relapse.
You know, you've talked about this overindulgence during the holidays, and you say there's a medical condition.
Yeah, so there's something called holiday heart, which is used to describe when you get abnormal cardiac rhythm as a result of drinking too much alcohol. So holiday heart is something that doctors see often during the Christmas holidays when people have been drinking too much.
Okay, so holiday heart, we have to keep that in mind.
Yes.
We're a little more prone to that during the holidays. Okay, so before we go, I do want to ask you about this because vaping has been in the news so much lately. Of course, we've had some deaths and a lot of illnesses here in California. What's the latest news on it?
Well, you know, smoking anything is bad for you, but what we're learning now is that especially smoking the cartridges, like a Juul, or even cartridges that don't have nicotine but have some form of cannabis in them, can cause irreversible lung damage and can cause death. So that's a pretty scary new development.
Okay, Dr. Anna Lembke, thank you so much for coming on.
You're very welcome.
Okay.